Hey there, it's Lee again, back with you from Griffith Small Animal Hospital, and today we're actually going to do something a little different. We're going to be doing a little vlogging experience with you guys to see employee's pet named Floyd get a dental cleaning. So we're kind of going to go through from start to finish, going through the admittance process, getting him prepped for for the dental, and then go through the dental and see what happens afterwards too when he gets ready to leave for the day. Alright, so we're here with Floyd, and Floyd's human, to do the admit process, and we're just going to go through it so you can see what an admit looks like. So the first paragraph that you see here is just the general consent to the general anesthesia, and it talks about inherent risk with any anesthetic process or procedure. And then while you're signing that too, just to let you know, we are going to do the preoperative blood screening.
Okay.
And it just basically tests a kidney, liver function, and glucose check to make sure that everything's normal before they go through the procedure. And then he'll have a little spot on his leg shaved where we put the IV catheter. So he'll be on fluids through the procedure and after. And then the next option we offer to you is microchipping. Now Floyd's already microchipped,
Right.
so we can just decline that. We just like to offer it while they're asleep because it's a larger needle and it's easy to get done when they're asleep. And then we have some options to you. If we get into Floyd's mouth and notice something that we weren't expecting, we can either go ahead and do what the doctor would recommend without contacting you, or we can contact you first, and then if we don't reach you, we'll go ahead and do what the doctor would recommend. Or we can call you, and if we don't reach you, then we won't do anything beyond the regular dental cleaning. And that sort of talks about x-rays and extractions. So you can just initial which one you would prefer.
Do anything you need to do.
And then we usually say the pickup time is between 4 and 6. When the procedure is done, either the doctor or the dental technician that performed the cleaning will call you and give you a more firm pickup time. And we usually keep them a few hours after they wake up just to make sure they wake up and we get them eating and make sure everything's okay. But expect a phone call, and then when you pick up, we'll send you with some go-home instructions and a little, chart showing everything that he had done today. Do you have any questions for me?
No, it sounds good.
All right.
Sounds like you know what you're doing.
Alrighty, well we'll take Floyd and we'll get started.
Okay, thank you.
Alright, so what I'm doing now is just getting Floyd's preoperative blood work, and we usually use a jugular vein since we're going to put a catheter in his leg. Okay, so now I'm just going to get Floyd's catheter started, and then he'll be ready to go. Good boy. Okay. All right, Floyd, you lay down. Good boy. So right now I'm just going to put a tourniquet on him, and this is going to help his veins stand up. If we're lucky, we'll get it in on the first try. And we just tape it in so it'll stay in all day. Floyd's actually being really good for this right now. Sometimes if we have a patient that's stressed or not really wanting us to touch their feet, we can go ahead and give them their pre-anesthetic medications first, and it calms them down, and then it's much easier to get the catheter in. But Floyd's being a great patient right now. We're all taped in. Take the tourniquet off. Then all that's left to do is get Floyd hooked up to his fluids and get him settled in a cage, and then he'll have his dental.
So right now we're going to go ahead and give Floyd his pre-medication that will help him get a little bit sleepy. We're going to go into his lumbar region and inject. And then we will wait about 15 minutes before we anesthetize him.
So I'm here with Floyd now. We have him on our dental table, and I'm going to go ahead and inject him with a little bit of Valium first to get him relaxed, and then I'm going to use an injectable anesthesia to get him to go to sleep, and we'll get a trach tube in and get him on his oxygen and isoflurane and get started on the dental.
Size trach tube 10.
Boy, it's okay, buddy. You're a good boy. Yes, you're a good boy. You're a good boy. Good boy. How you doing?
If you've made it this far, I hope you enjoyed watching Floyd get his dental cleaning. If you would like to watch another video on home dental care, we have one that's called How to Brush Your Dog's Teeth, and we'll link it in the description box below. Also, if you can think of any other videos that you would like to see or anything else you would like to know behind the scenes, just leave a comment in the comment section. Thanks for watching. Hope to see you next time. Bye!